Welcome to Sunnyside Academics, your one-stop YouTube channel for students and professionals. Today's topic: disorders and therapeutics in respiratory system. First, we shall be looking at altering concentrations of oxygen and carbon dioxide. Later on, we shall then be looking at disorders that are associated with physical conditions of lungs and airways. There are disorders in respiratory system that leads to imbalance of oxygen and carbon dioxide concentrations. Such respiratory disorders, if sustained, has the potential for depleting oxygen and carbon dioxide levels. For example, a cigarette smoker of over 10 years can be experiencing a level of deviations of respiratory system. Such a smoker could notice that her respiratory system could feel different without smoking. From a medical point of view, the smoker has been inhaling gases and volatile chemicals from cigarette smoke. After a while, the lungs would have compensated for inhaled cigarette smoke and would have been absorbing pollutants from cigarette smokes. So with sustained cigarette smoking, a smoker's respiratory system deviates in response, and which could be noticed from the smoker's cough, wheezing, shortness of breath, and having short energy duration due to insufficient aerobic metabolisms, over time leading to insufficient energy storage. Symptoms of oxygen depletion and harm caused by cigarette in long-term smokers can be remedied by quitting. When a cigarette smoker quits, cells lining the airway that are otherwise harmed by smoke can get replaced during cell regeneration. Although the rate of cell regeneration can vary by cell, age, environmental, and genetic factors, so quitting smoking will avoid harm to regenerated cells. There are a whole host of other causes of oxygen depletion. We have mentioned smoking to be a cause of oxygen depletion in minor to major cases of severe chain smokers of so many years. Another cause of oxygen depletion can be by low hemoglobin count, meaning less hemoglobin available for oxygen transport. We are not going to discuss the anatomy of hemoglobin, but hemoglobin is a quaternarily structured protein which functions to transport oxygen around the body to tissues in need of oxygen. It has a heme prosthetic group that aids for reversible binding of oxygen to each structure of a quaternarily structured hemoglobin. Hemoglobin depletion is as a result of anemia, which is a low red blood cell count. There are several causes of anemia, and to mention a few: iron, folate, and vitamin B12 deficiencies can lead to anemia. So, at the tissue level, when there is insufficient oxygen for metabolism, it is called hypoxia. Hypoxia is treatable by oxygenation by supplying oxygen through the mouth or nose, and of course by treating anemia with either vitamin supplements or other necessary interventions. Apart from oxygen binding reversibly to hemoglobin, like oxygen has an affinity for hemoglobin, carbon dioxide also has an affinity for hemoglobin, and so carbon dioxide has the propensity for altering oxygen's affinity for hemoglobin. The Bohr effect describes that oxygen binding affinity for hemoglobin can be altered by carbon dioxide concentration. So, A low level of carbon dioxide, called hypocapnia, and its resulting respiratory alkalosis can increase oxygen's affinity for hemoglobin, meaning oxygen can stay bound to hemoglobin for longer than necessary, and thereby causing oxygen depletion. On the contrary, a high level of carbon dioxide, otherwise called hypercapnia, and its resulting respiratory acidosis can reduce oxygen affinity for hemoglobin. In asthma, inflammation in respiratory system can cause disorder of the respiratory system. Inflammation occurs as a body's defense mechanism or a response to injury. Asthmatic conditions are associated with inflammation of airway wall. It is an episodic narrowing of the bronchi, thought to be caused by an underlying chronic inflammatory disorder. Studies have shown various types of inflammatory cells seen in the airway of an asthmatic patient, notably eosinophils, basophils, mast cells, macrophages, and some lymphocytes are present in the airway of an asthmatic patient. Inflammatory mediators and various cytokines are also present in the airway of an asthmatic patient. Inflammation in asthma can be induced by allergens, and there are also other forms of inducement that are not by allergens. Anti-asthmatics are medicines in asthma, and they are usually based on their broader purposes of inhibiting inflammatory responses and or relaxing bronchial smooth muscle. Bronchial muscle relaxants such as beta-adrenergic receptor agonists can be, for example, short-acting Ventolin or salbutamol inhaler that is used for relief by reversing bronchoconstriction, while long-acting formoterol can be used together with other medicines like anti-inflammatory medicines that inhibit inflammatory responses to treat bronchospasm and anti-inflammation in asthma. Examples of anti-inflammatory medicines are glucocorticoids, leukotriene receptor antagonists, and leukotriene synthesis inhibitors, etc. Each type of anti-asthmatic drug can differ from the other by its mechanism of action or site of action for exerting its anti-asthmatic effect. In chronic obstructive pulmonary disease, or COPD, it can either be emphysema or bronchitis. It has a destructive effect on airways condition because it causes damage to air sacs with emphysema and long-term inflammation of the bronchi of the lungs with chronic bronchitis. Drugs in COPD involve inhibiting involuntary muscle movement with anticholinergics like tiotropium, commonly known as Spiriva, and umeclidinium, known as Incrus ellipta. There is a disorder in the respiratory system that leads to bronchiolitis or pneumonia, particularly in babies. It is a disorder caused by a virus known as respiratory syncytial virus, or RSV. Antibodies that fight against this virus are sometimes administered as a preventive measure to prevent babies from developing bronchiolitis or pneumonia. Thumbs up. I'm delighted sharing. Thank you all. Sunnyside Academics.